Welcome everyone, and thank you for being here with us for our webinar. The topic for our webinar today is Occupational Health 101, how to use employer tools effectively. And the reason why we wanted to get this webinar over to all of you was we wanted to highlight these employer tools, which are very important in bridging the communication gap, not only between providers, employers, and patients, but also sometimes between the third parties involved in the process. And apart from these employer tools also ease the administrative burden for the occupational health and employer health clinics. So I hope today's webinar provides valuable information to all of you and it is helpful for everyone. I am Diya Ranjan, and joining me in today's webinar is our presenter, Monica Walker. Monica is the Business Development Manager at Bizmatics and is very well versed with occupational medicine. Monica also has 20 plus years of experience in practice management and billing for employer health, occupational health, primary care, and pain management. So thank you, Monica, and for being here today. A few housekeeping items before we begin. We will be having a Q&A session at the end of the presentation. So please type in your questions and send it to us, and we will answer them in order. The recording of the webinar will also be available to you in a follow-up email. You will be having the recording as well as the decks from the webinar today. PrognoCIS customers can also access the details from our resource center. So welcome, Monica, again, and it's over to you now.
Awesome. Thank you, Dia. Thank you, everyone, for joining us today. For those of you who've joined me for some of my previous webinars for occupational health, some of this may be a review. However, we do have a few new enhancements, excuse me, in the employer area that I'm excited to share with you all today. So moving forward here. Our agenda for today is employer protocols, again, an area I've covered in the past, however, a few new things there. The employer portal, doctor forms specifically for employers, DOT certifications, our new pre-authorization tracking module, drug screen randomization, interfaces with employers and employer software, telemedicine, bulk claims for flu shot clinics or on-site clinics, and a few additional tools that I've covered in previous webinars, for instance, on the occupational and work comp side. However, I'll just briefly cover those again today at the end of the webinar. So I'm going to be switching back and forth between our slideshow and PrognoCIS so I can actually demonstrate a few of the areas, particularly the employer section, employer protocol section of PrognoCIS. However, I included in the slideshow basically what I'm covering in the live demonstration as well. So you'll have that information as you receive that slideshow with a little detail and some different caveats and things specific to those areas. So just briefly covering what our occupational health and EHR, employer health EHR, is intended to be utilized by, obviously, occupational health clinics. We also have on-site employer health clinics, near-site employer health clinics. A lot of urgent care and primary care provide occupational services, and then there are also employers who manage employer health clinics that also utilize our software. So this can be utilized by a large variety of different types of users. And we have a lot of really great tools that are focused on employers. So our employer protocol area gives you the ability to set up protocols by employer or by position, by job number, lots of different things. I actually myself came from an occupational health clinic before we really called it occupational health in the early 2000s, and I would have loved to have this software. And so when I came to PrognoCIS from pain management and realized we had all these great tools, I kind of have become a software nerd about them now, and I just love them. So I'm going to flip from here. Again, there's additional slides here that kind of give you instructions on kind of what I'm going through and where I'm going, but I'm going to flip into PrognoCIS now and actually show you guys the employer portal or employer protocol section. So when you are in your software and you go to settings and configuration, you will see in your list of vendors here the employer listing. So when you click that list, it pulls up the names of all of your employers. So I have quite a few set up, but I'm going to pick one today that I've set up a lot of information in and kind of focus on that particular one. But you can have, an unlimited number of employers listed in your system. You can all calls, multiple employers, kind of subcategories for an employer as well. So if you have some really specific things that, for instance, a fire department versus a police department want, and you want to keep everything really separate, you could always set those up as, the town of X fire, the town of X police, and keep that information really separate. Or there's also some ways to split that up within the employer itself. So a lot of flexibility on the setup, and you can really get creative to make this really meet your needs. Our software is extremely flexible. Our biggest strong suit is the flexibility of our software, and they're constantly enhancing these areas. So we really listen to our customers, particularly on the occupational health side, since this is kind of a really big growing area for us, to add additional features and tools. So if you're an existing occupational health clinic or customer, and you have feedback, please make sure you provide that to us. If you're utilizing these tools and they don't particularly give you exactly the functionality you need, we want that feedback as well. So definitely you can provide that to me. You can also provide that to support or your implementation manager, depending on kind of where you are in the process. So going into our employer health area, this little green button would be the place to go to add a new one. Obviously, our binocular here is our search binocular. Our employer name here, we have the kind of overall business address for your employer here. Not necessarily the phone numbers or email addresses or fax numbers of the individuals that you're sending information to, but more of an overall area to store that information. You can kind of categorize them by nature of business, give them some external ID if necessary, load their tax ID. You can list different departments within the organization. And so these departments can have associated employees assigned so that they're kind of grouped, or this can also be the way that you separate who within an organization receives the email, who receives the records, and things like that. You can load different addresses for these departments based on their location, fax numbers, phone numbers, and within the letters out screen, you're able to fax to that particular department based on what's in the patient's record. You can also see a history of who added that particular department and when it was last edited. So anything here, you can also mark things inactive as necessary. The next section is the user section. So these would be all of the users for Aero Industries who would have access to the employer portal. And so you can list their names, add their department here if they're assigned to a specific department. You can control what access they have. So do they have access to the patient records that we're sending through the employer portal, or are they simply only allowed to have invoices or see their payments or their aging? Also, you can allow them to set up their own departments users and add additional departments and users. And so you can turn those items on or off based on your individual clinic needs. If you would like to have complete access and control of all of the user management for your employer portal, by turning those individual items off, you restrict their ability to add additional items there. So you can have complete control if you want, or allow them to kind of self-manage their account. Also within this, you can have individual addresses, phone numbers, and fax numbers, and email addresses for the individual users within Aero Industries. You can add specific notes. So if someone's on vacation for a period of time and someone else is filling in, you can add those notes in there and see that particular information. You can also see the history of who has added or edited that person's information, and obviously mark them inactive when they no longer work for that employer. The next area are jobs. And so if you do have specific jobs or job numbers or any other kind of category that employers would like to have their employees grouped into, or their invoices and charges grouped into, you can utilize this area for that. You can add multiple jobs there. And then this area is what I think is the most important in this entire section, which is our employer protocols. So the protocols are where you would store the particular items that that employer would like you to provide, the services they would like you to provide for that particular type of employee or visit. It could also include things like vaccines, could include on-site things, anything that you would like to give as instructions for your staff on either questionnaires that need to be completed or particular procedures, tests. You can include lab, radiology, obviously procedures. Procedures can also include things like DME, or any kind of items that you're handing out, physical examination templates, vaccines. You can also utilize this for travel medicine as well, and even categorize that by region if necessary. And then obviously any kind of work comp areas, you can also include those. So you can have multiple different protocols for each employer. And when you schedule an appointment for that employer or for a patient who has that employer listed in their contact section, you have an additional drop down in the scheduling screen that gives you the ability to list or load the protocol that applies to that particular patient's visit. And then when you go into the encounter, it controls the information that's in there for your staff to complete during that patient's visit. The contact information here is kind of the overall contact for that organization. So if you have someone who's kind of the main person that you are dealing with at that organization, you can load that information there. If they are CEO or HR director, that's kind of the designation area there. We also have the ability to send medical review. And so what the medical review area does is it gives you the ability to send via encrypted email or fax the progress notes when the encounter is closed for each individual at that organization. So if you want to automatically send those records via email or fax and you don't want to have this person log into the employer portal to receive this information, this will automate that function. So you can either do email or fax to a single individual. However, that's really handy for those organizations that, maybe are smaller, maybe don't have someone who can be dedicated to logging into the employer portal, or a really large organization that just gives you a fax number to send those records to at the end of the visit. And so you can tailor the information specifically that is sent for that type of visit. If they need specific information too, you can give a specific type of progress note that'll pull the information that you need for that particular employer. The next section is a new feature that's been added. So this is an ability to store specific attachments for an employer. So if you have forms that need to be completed, that they want you to sign something on paper and scan it in, or just maybe you want records of the forms they provided you before you built them in PrognoCIS, you can attach those here and then view them later. You could also attach things such as contracts into this section, so you can have multiple different attachments per each employer so that you can have this information here, be able to print it, download it, so on and so forth. So a really nice way to kind of manage not only your medical piece of that particular employer and the billing piece of that particular employer, but also to kind of keep all that paperwork together and handy. So I like that new feature. The next section is the insurance details. So if that particular employer utilizes a specific carrier for work comp, or maybe you're also billing their Blue Cross Blue Shield for their claims, you can load that information in here, load the policy number, makes it easier for you to find that information quickly when you're loading a patient with this employer. You can also load notes in here that will show on your schedule screen. So if you have some specific instructions for the staff for what happens with a failed drug test, or if somebody can't pass a specific type of procedure or screening fitness type test that you're doing in the clinic, and you want to have some specific instructions there, you can put those instructions in that area, and then you can see them within the patient's record. Another new area that we have is the encounter details. And so within this area, we can determine if you just want to allow specific encounter types for this particular employer. So for Aero Industries, I actually set up some particular encounter types just for this employer because I had some kind of special things that I wanted to include for them. So if I wanted to restrict the ability or to specifically say which encounter types that they apply to, I select that in that area there. Our billing and invoicing area, the quickest and easiest way to find the billing information or the historical billing information for a particular employer, in my opinion, is to come here. You can obviously also look at that within the billing side. But if you come to the employer here, you can click this one button and it takes you directly to their AR. If they have additional TPAs that are associated with their account for billing, for instance, drug screens and things like that, you can also see that. You can see employer invoices by claim number, by charge code, all the way down to the very nitty-gritty detail, a list of their outstanding invoices by both the employer as well as the TPA, and then invoices by claim. So there's a wealth of information in here, and you can come directly in here, click on those items, view those individual items if you would like to, print it, any of those variety of things to find that information very quickly and to monitor that. We also obviously have a full area of monitoring specifically the employer balances and AR in the billing area as well. The next section is the split claims. So this is a really handy and popular way to send those charges to those TPAs or any other specific parties that are involved. So if you have an employer who utilizes Align or eScreen or any of those other third-party administrators for pieces of their employment services such as drug screens and those sorts of items, when you enter them here and put the associated charge codes, it automatically splits any claims for this employer that contain those charge codes. So if you are billing your 99214 and your audiometry to the employer, but the drug screen needs to go to eScreen, if this code is in the patient's claim, it will automatically split it into two claims and make that claim the responsibility of eScreen so that you can separate it. It's still attached to that employer so that you can track that separately, but it does put it under the TPA so that you can submit that claim to the TPA if necessary. You can also do the same thing for workers' comp. So if there are specific codes that only get billed to workers' comp, you can split those there as well. And then if you have an employer who doesn't pay for certain services that their patients may want to come in for, things like B12 shots or weight management services, things like that, you can put those charge codes in this section. And if you have a patient who comes in with that employer or work comp or any of these other kind of scenarios here, it will automatically drop those CPT codes to the patient and not to the employer. So you don't have to worry about accidentally billing the employer for something that they don't want to pay for. The next area is how you set up your invoices. So in my past experience, I had to create these really elaborate invoices in Excel sometimes and provide them for employers because they just wanted very specific information. Some of them didn't want to see the CPT codes. Some of them wanted us to make up CPT codes or use a specific code for our billing, which you can use our customized CPT codes for, which is nice. But this would have been really handy to utilize in that situation instead of kind of making my own, but we did what we had to back then. So in this area, you can invoice by the encounter type, the department, or the job number. So if they have kind of specifics on how they want to be invoiced, you can utilize that area. You can group those invoices by patient. So if you have a patient with multiple charge codes, it would group all the charge codes under that patient. You can group it by charge code, so list all of the spirometries and audiometries separately. You can load it by data service by patient or by data service by charge code. So you can group that invoice the way that they would like to see it. You can also hide the charge code if they don't want to see the CPT code. You can schedule that invoice to be sent electronically, monthly, weekly, or daily. You can also put in the days that you have negotiated with them for payment days, any purchase order numbers that are associated. And then you also have the ability to have an unlimited number of specific formats that those employers want. So if you have some very particular instructions on how to bill an employer or a customer, you can create an invoice format specifically for them. You can also send that invoice automatically via email to a specific email address, and that also goes in the employer portal. So this would be utilized primarily in the situation where you have kind of like the medical review, someone who doesn't want to log into the employer portal to retrieve their invoices, but you want to just send that via email. And then the last area here we have is our employer fee schedule. So you can again have multiple different fee schedules, or you can use kind of one fee schedule and put the percentage of that fee schedule in here, just depending on how you price out your employers. I know sometimes that can get very confusing and can be very elaborate as well. So multiple options there on being able to charge that employer the exact amount of money that you want to, and it kind of automates that, or does automate that charge entry piece of it for you so that the right prices are charged for each CPT code. And lastly, you can mark them inactive if you're no longer working with that employer, and you can see who last modified the record and the last time that that employer logged into the patient portal, which is another new little piece down there, which I like. So that is essentially the employer protocol section. So the next thing on our agenda is to go to the employer portal. And after we get through these couple, I'm going to flip back into PrognoCIS, go through the doctor forms and the DOT certifications and the pre-authorization tracking. Then I'm going to flip back to my slideshow for the last few sections. So we're going to jump down a bunch of slides and we go back to the slideshow. So our employer portal, very simple, very easy for employers to utilize. You can automate your information being sent to the employer portal, so your invoices as well as your patient records can go through this automatically. So you'll have a specific URL for your particular practice, so it'll have your practice name in there and employer login at the end here. So when you give them their login to be able to log in, any records that you have shared with that practice will automatically be listed on this screen. So you can click a particular patient's name and see all of the records and dates associated with that patient. You can click these little view icons to pull those up and look at those, print them, so on and so forth. You can also, whoops, I haven't logged in twice. We can also go under the billing tab, see the invoices loaded in different ways. So you can separate out those TPA from the employer invoices. So kind of multiple different ways to view those there. You can also see the payments that have been sent in. So if they have sent us a check and we maybe haven't posted it yet, they can see the payments that have been sent but not yet posted. They can see the specific invoices and all the details that you put in about those payments. They can kind of reconcile their own, again, if you give them access to be able to see this information. And then we also have our user management area, so they can see the list of their departments along with the addresses, turn those off, see the history information there as well. They can also see their list of users, add an additional department, add a new user. So again, each of these tabs depend on, in that employer protocol setup, giving that employee or that employer access to their own information and access to these particular areas. So if you have that turned off, they just simply don't have the ability to go to those areas. And that is our employer portal. A couple other little notes there. So this is another area that we are enhancing tremendously. So there are some additional things coming to this area, such as the ability to schedule appointments and things like that for employers. So more to come in this area. Send you attachments. We're working on making this mimic more of our attorney portal, if anyone's used that, or our patient portal, so giving it some additional usability based on input from our customers. All right, and so our next area is doctor forms and DOT certifications. So for employers, a lot of them have specific forms and things that they would like you to fill out, or maybe you have some forms for your particular practice that you already utilize. So a lot of our occupational practices have come from a situation where they have had paper forms and things that they've used, for many years, and they like those paper forms. They work really well. They have all the information. you can basically have doctor forms created that mimic that paper workflow and look just like your paper forms do. So you can have something like a pre-employment physical that has all the information, including your physical exam and everything that you might like to utilize for your particular practice. So it could be an employer-specific version, could also be just your own practice-specific version. You can also utilize letters out for employer-specific documentation. And you can also have the output of a regular template look the way that they want to based on kind of their form they've given you. So multiple options in suiting employers. The doctor forms area is not as easily customizable. It is something that we have to customize for you instead of the letters or the templates, which you can also learn how to customize. But if you know what you want and you know that form is going to work for you, we can build it for you and it works really well. We also, on the workers' compensation side of things, have a lot of state-specific forms such as Texas, and we also have California's in here. So lots of different ways to utilize the system for those employer-based services. So again, this area is very customizable. If you can draft it up, we can create it for you. The next item on our list is DOT. So I'll show you first in the doctor form area kind of what those look like. So this layout kind of looks more like the big old paper forms that we used to fill out, where you can see each area of the DOT form. And these may be the last version and not yet updated for the newest version, but essentially you can see what the layout looks like. And then we also have the ability to provide the certificate, including the little card that goes in a patient's wallet for DOT. So you can fill them out in this area, or we also have the ability to add a DOT template into your actual template area. And no matter which place you fill them out, it still goes to this area. So those fields and everything are saved into your system. So this is more of a template-based documentation. You can also push the patient's portion of it through the patient portal or the tablet to have the patient complete that as well. And you can also have the patient sign the card in the legal section as well. So multiple different ways to keep that entire process electronic. And another new interface that we are just finalizing is the ability to upload those on the federal database. So if you guys are currently utilizing these or interested in that, definitely reach out to sales or to, I'm sorry, not sales, but to support or your implementation manager, or sales if you're not yet a customer, if you would like more information on that. Or for that matter, any of these things that I've shown that you would like to have pulled into your database, support can help you with that. So our last area kind of in the system is the pre-authorization tracking. So to access the pre-authorization tracking section, it's under the CPOE menu, and you'll see pre-authorization tracking. When they added this module, it was not turned on for most customers, so you may not see it in your database. However, it should be there. You just may need to have it turned on. So again, support can help you turn the property on for that and kind of help you get it set up. But basically what this does is anything that is ordered within an encounter type that is designated that it needs pre-authorization, it will automatically dump those orders that you put into your order sheet into this list for pre-authorization. So as you see a particular patient on a date of service, anything that was put into that order sheet will then flow into this area so that you're able to see the items that were particularly ordered for that patient. And so if you have things that were ordered and, oh, I don't need that 5-panel drug test, you can remove those from the particular pre-authorization. You can track the status of each item. So if some of them are approved, but you're waiting on some other items, you can look at that there. You can see the progress note from that visit from this screen. Takes a second to load. You can also view the insurance information, run eligibility. You can see patient demographic information. So it's designed so that if you're working these pre-authorizations, that you can see a whole lot of information from this screen, add notes for this particular pre-authorization, send messages to other people within the organization. And then you can also generate a letter that needs to be sent to a particular agency or organization. So if you're in the state of California, we have the request for authorization form in there. Your state may not require that, but you may need a templated letter that you want to send to insurance companies. You can send this information to those parties, decide what information you want to pull in there, attach items from the patient's chart, including your progress notes or records, and then track the status of that that request for authorization within this screen. You can leave the authorizations in here and filter it by open and closed, so you're only seeing the open ones here, but we do have this filter that will give you the ability to filter it by in progress, open, closed, so on and so forth. So it gives you this nice working list of pre-authorizations that are pending completion or even completed for that matter. So a little easier than kind of sending messages or keeping these things in your inbox. But again, in order to utilize these, you have to have that turned on within your encounter type. So that way, if you just need to do pre-authorizations for work comp or a specific employer, then you can have that encounter type turned on. Use that encounter type for those patients, and then your other encounter types will not have the orders from that particular encounter put into this area. All right, so flipping back to our slideshow here, I'm going to, so all of these slides that I'm skipping past are kind of screens that I have covered here. You guys will have that in the slideshow there. So last few things that we're talking about today, I want to wrap up so we can get some time in here for questions. So drug screen randomization. So this is obviously very helpful for any employers that need drug screens. I know I personally have done a lot of really interesting things to try to randomize drug screens for employers, and then in a pain management clinic on our own, when Medicare decided that was the way that we should handle our drug screens, we had a set of dice and all kinds of crazy stuff. So the system can randomize those drug screens either for your own patients, if you just happen to be a pain management clinic or urgent care clinic and you have opioid-based patients that need random drug screens, or also for employers. So basically the way that works is you have different parameters. So based on the employer, you can decide whether you're going to get a list of patients that need drug screens or whether you want to actually create appointments for those patients. And so for that particular employer and their preferences, you would put in the parameters that apply to that employer and then run a scheduled process. And that can be run monthly, quarterly, annually, just depending on how often they would like to receive that list of patients or have those patients scheduled for their drug screens. And the next slide actually has a little video that one of our training department has put together on exactly how that process works. It's only about a 4-minute video or so. So I'm not going to bore you guys with all of those details today. However, that is a resource for you if you would like to review that video and really go step by step on it, on setting a couple of those up and really seeing how they work. It's a really nice process and super helpful for our customers. The next area that I just wanted to talk about is interfaces. So really nothing to demonstrate other than to just say that we are active with a ton of different interfaces, and employers in a lot of areas have, larger employers have asked us to integrate with their payroll system or HRIS systems. We also, as I mentioned, are interfacing with the federal DOT database. And in some cases, you might have an employer that has some other kind of EHR software system. They might have an on-site clinic that they handle 75% of their employees, but you're a near-siting clinic and you're handling 25% of their employees. We can also interface with those systems. So interfaces are available and an option for you to kind of automate that information back and forth. And then obviously between lab and radiology, also your equipment if necessary, your audiometry, x-ray equipment, those sorts of things. Telemedicine, always have to put a plug in for telemedicine in 2020. So we have spent a tremendous amount of time and energy enhancing our telemedicine area this year. Just a little screenshot of kind of how the telemedicine section works. But we have a couple of options. We have our Zoom-based telemedicine that's been around for several years, and now we have integrated in the last several months our own integrated telemedicine, which does not require the patient or the staff to have Zoom or to log into an external application. It just sends the patient automatically a text message and or email, depending on how you set everything up, with a link to their meeting. It can also take them through the process of collecting a payment, filling out patient forms, signing a consent form to be treated via telemedicine. So again, based on your particular practice needs and configuration, but you can see that telemedicine visit right here within the third panel of your screen. So it's kind of nice to be able to see that information right there while you're documenting your patients. And we also have some additional information on telemedicine and working on a video to kind of demonstrate that as well. So this is the little section of our website that has telemedicine specific information there, and that's constantly being added to as things change and are enhanced. Last couple little sections, so bulk claims for flu shot visits. So if you have the need to do on-site services, flu shots, any kind of cholesterol testing and those sorts of things, we now have a bulk claim area that gives you the ability to enter claims from multiple patients within an organization. So you can select the patients, put in the specific employer you're looking for, select the patients you want, put in your CPT codes, your ICD codes, all of your claim information, your provider, your data service, an encounter type, and then hit OK, and it will generate bulk claims for all of those particular patients on that data service under that provider. So it gives you the ability to really quickly put all those claims in at one time if your employer wants you to bill those to their insurance. And then just a few additional features to mention that are helpful for employer health. So we do have a return to work module that some of our larger employer-based health clinics have started utilizing, which helps their HR department track how many days that patients or their staff have taken off of work, what their work status is, and a date of return to work. So it kind of gives them that extra place to log in and see that information. It's kind of its own separate database. We also have case management for workers' compensation, and you can also submit your work comp claims electronically and file those with your medical records now. I covered a lot of those pieces of information in our workers' compensation webinar that we had a couple months ago, or maybe a month ago. So if you would like to see that, it is in the resource center. And if you're not a current customer and you'd like access to that, you can shoot me an email and I can send you the link to our YouTube channel where we have that listed as well. You can also utilize health maintenance reminders, particularly helpful for surveillance examinations. So you can set up when they're due and then utilize that health maintenance section for callbacks. And also if you have your patients utilizing the patient portal, you can send them automated reminders that those sorts of things are due. And then we also have some additional features, one of which is a employee badge check-in system. So if you're at a particular employer and you would like to utilize their employee badges to check in and know who they are, kind of scan themselves in, that's also coming soon, or may actually be maybe by now. So that is the end of our webinar for today. Hopefully there was some helpful information for everyone, but I want to encourage you to follow us on social media as we have new things that are coming about or interesting things. We constantly are sharing information on social media, so a link here to each of our social media platforms. And that is about it. So here's contact information. So if you would like to reach out to me specifically for questions, my email is right here. And then obviously, if you would like to review this webinar later, it will be loaded in the Resource Center. And if you have any need for particular templates and things like that to be loaded, I also encourage you to reach out to either your implementer if you're still in implementation, or to support. But if you aren't able to reach one of them for some reason, you're always welcome to email me as well. And back to you, Dia.
All right. Thank you so much, Monica. That was a detailed information on, all the tools and resources that we have for occupational medicine. And as you rightly said, I wanted to reiterate that PrognoCIS really is a very customizable software. You can do it according to your needs and requirements. And I think all the tools that we showed you today are very helpful in conducting the entire process of occupational healthcare right from start to finish, whether it's the employer protocol, employer portal, all the new enhancements that we did, whether it's the ability to store attachments, so all the details, and I hope that this was very helpful for all of you. So let's, Monica, let's move on to the question and answer session.
Okay.
I have a few questions and I am reading it out to you. And if any of you have any questions, please type it in the question box and send it over to us. Monica is here with us for some more time and she will answer your questions. So let's go ahead. The very first question that we have is, can we send messages to employers in the employer portal?
So that is one of the enhancements that is coming. So currently, as I mentioned, we're trying to make it more similar to the patient portal, I imagine, and things like that with the increased functionality. But that has been requested by several of our customers, so that is on the way.
Okay, all right. Is it possible to have multiple fee schedules loaded in the system?
You can have multiple fee schedules, and so within our, let me flip back to PrognoCIS, within our employer section that we looked at today, you can see a few in my dropdown. I only have a few in this demo database, but we have a few different employer or a few different fee schedules here. This employer one is just named EMP to abbreviate employer, but you could have specific employer fee schedules in there if necessary, if you have some that are just very customized and specific. So absolutely, you can customize that and make as many as you need to.
Okay. The next question also is actually asking you to show. So this is access billed claim area in the billing side. Can you show how it works?
Sure. So the employer billed claim area. So when you come in, oh, the bulk claim, was that bulk claim?
It just says access. Yeah. It doesn't mention anything.
Okay. Well, I'll kind of show both.
But yeah.
So in the bulk, I think it might be bulk.
Mm-hmm. Yeah.
Which would be for the flu shot area. So to access the bulk claim area, when you come into the billing section, you will see the claims option up here at the top. And when you hover over new, you'll see claim, penalty, invoice, and bulk claims. So that's how you access that screen that I showed. And so when you click the select patient button, it pulls up a list of patients and has the additional search here for the employer name. So if you need to find all of the patients associated with a specific employer to choose those patients to enter, for instance, flu shots, you can quickly and easily come here and find those patients listed by first, last name, so on and so forth. And you can sort them by any particular area to be able to select those and generate those claims. So there you go.
Okay. All right, moving on. The next question is, how can we find a total for all of our outstanding employer invoice?
Okay, that's an easy one. So on your billing home screen here, you have this little dashboard here at the top, and your employer section is right here. So you'll see here is our total of our outstanding charges currently for employers. And when you click that, it actually pops up a relatively similar list to what you would see in the employer portal or also within the employer protocol section, but it's actually separated by all of your different multiple employers here with your patient detail, with the total billed as well as the balance amount. So very easy to find, and you can also print that information if you'd like.
Okay. So here's the last one. The question is, can we document results for a drug screen done in the office to create a lab result?
Yeah, absolutely. So let me flip back over to the EHR and I will show that to you. So let me go back into Mr. Williams here. So basically you can set up a, for your drug screen, if it's a 5-panel or 7-panel, you would set up a lab order for that particular drug screen type. So you would, I just happen to have a 10-panel in here, so I'll pick that one. That's my preferred list, and obviously I can search all of the different lists here. So you would put that in and choose your in-house options. Since you're doing that drug panel cup in the house, you can select when it was received. And then when you go to the lab results screen, you'll see the panels of drugs that you have included in your panel of drug screen, and you can put your results in here, either negative, consistent, or inconsistent, or we can also give you a little drop down here where you can choose positive, negative, so on and so forth. So kind of multiple ways to be able to do that. And if you utilize the drop down, you can determine which one is abnormal or normal, so that once you have saved this, just do that real quick, you can preview this and it looks just like a lab result that you would have even from the lab in the patient's lab result area. So it's a good way to be able to mix those drug screen cups in with drug screens that are actually sent to the lab. And you can customize what the lab result actually looks like. So this is another form that can be customized within the system. So yeah, gives you the ability to quickly document that. And if you use the little drop downs here, you can select all of them to negative at the top and then just put the positive ones in there. It makes it really quick. Yep.
Right, Monica, that was all for today. And I think you did put your information out, so people can reach either you, or we have the support information. If you can put that up for everybody,
Yep.
and you can reach out to Monica or to support. So thank you once again, Monica, and thank you to all our attendees for being here with us today. We will be providing you all the information in a follow-up email. And as I stated earlier, our customers can access it from our resource center also. So thank you to all. Have a good day. Bye for now.
Thank you, everyone. Bye, everyone. Thank you.